A resident wears a hand splint. Which observation should the nurse aide report to the nurse immediately? A. The resident's fingers are cold and blue in color. B. The splint was removed as scheduled in the care plan. C. The resident asks to have the splint removed for a few minutes. Or D. The resident asks the nurse aide to reposition the arm with the splint. Correct answer is A. The resident fingers are cold and blue in color. Always report a change in color. The nurse aide is bathing a resident and notices new swelling in the resident's ankles. Which of the following is the best response by the nurse aide? A. Ask if the resident has been eating salty foods. B. Elevate the resident's legs and check again later. C. Report the swelling to the charge nurse. Or D. Avoid bathing the resident's lower legs. Always report swelling. Correct answer is C. Report swelling to the charge nurse. The CNA knows that a resident has the right to make choices. There will be questions where the correct answer is the answer that gives the resident choices. Look for these phrases. Would you like? Would you prefer? Do you have another preference? Okay, a resident says, I am not going to eat this food. It is poisoned. What is the best response by the nurse aide? A. Offer to taste all the food first to prove it is not poisoned. B. Report to the charge nurse that the resident is acting crazy. C. Ask if there is something else the resident would like to eat. D. Leave the resident alone because the resident will eat when hungry enough. Correct answer is C. Ask if there is something else the resident would like to eat. A resident who is Roman Catholic is dying. The resident comments that she has not been to confession and she worries that she will die in a state of sin. Which of the following is the best response by the nurse aide? A. Don't you think God knows you are in a nursing home? B. Would you like it arranged for a priest to visit you? C. Sounds like you are not ready to die. Or D. Have you considered praying? The correct answer is B. Would you like it arranged for a priest to visit you? While watching the residents in the dining room, a nurse aide notices that a resident is eating very little lunch. It is most important that the nurse aide A. Check if the resident was snacking before the meal. B. Ask if the resident would like something else to eat. C. Remind the resident that dinner is several hours away. Or D. Check when the resident last had a bowel movement. Correct answer is B. Ask if the resident would like something else to eat. A resident is scheduled for a morning shower, but is refusing to take one. The best response by the nurse aide is to A. Explain that the shower is required to keep clean and healthy. B. Try to motivate the resident by collecting clothes and supplies. C. Ask if the resident has another preference for bathing today. Or D. Remind the resident you do have the right to refuse care. Correct answer is C. Ask if the resident has another preference for bathing today. When a resident refuses a bed bath, the nurse aide should A. Offer the resident a bribe. B. Wait a while and then ask the resident again. C. Remind the resident that people who smell don't have friends. Or D. Tell the resident that nursing home policy requires daily bathing. Correct answer is B. Wait a while and then ask the resident again. There will be questions about catheter care on the state exam. Review in your textbook and remember these important things. The bag is always below the bladder. The bag is secured to the bed frame, never the rails. The bag may be attached to the seat of the wheelchair. The NA should check tubing for kinks. The NA should clean downward 4 inches. The condom catheter is changed daily and empty when half to 3/4 full. A resident with an indwelling catheter says, I need to urinate. Which of the following is the best response by the nurse aide? A. Check to see if the tubing is kinked and draining properly. B. Report to the charge nurse that the resident is very confused. C. Remind the resident that it is impossible since the catheter is in place. D. Tell the resident to try to urinate since the urine will collect in the bag. The correct answer is A. This is the best response. Check to see if the tubing is kinked and draining properly. A resident has an indwelling urinary catheter. When the resident sits in a wheelchair, where should the nurse aide place the drainage bag? A. On the floor, directly next to the wheelchair, positioned well below the resident's bladder. B. Tucked at the resident's side on the seat of the chair to keep the drainage bag level with the resident's bladder. C. Hung from the back of the wheelchair so that it is out of the resident's view and above the bladder. D. Attached to the seat of the wheelchair, positioned below the level of the resident's bladder. And the correct answer is D. Attached to the seat of the wheelchair, positioned below the level of the resident's bladder. A resident has an indwelling urinary catheter. While making rounds, the nurse aide notices that there is no urine in the drainage bag. The nurse aide should first A. Ask the resident to try urinating. B. Offer the resident fluid to drink. C. Check for kinks in the tubing. Or D. Obtain a new urinary drainage bag. The correct answer is C. Check for kinks in the tubing. You will see questions about oxygen care on the state exam. Let's look at some examples here. When a resident is receiving oxygen, the nurse aide should A. Make sure the tubing is free of kinks. B. Remove oxygen when the resident is eating. C. Place a no visitor sign on the resident's door. Or D. Limit how often mouth care is provided to the resident. The correct answer is A. Make sure the tubing is free of kinks. Remember to review the healthcare team. Know the roles of the healthcare team. Which member of the healthcare team counsels residents and their families and arranges for needed services? Correct answer is B, social worker. Okay, be ready for these questions about skin breakdown and pressure ulcers. What is the best reason for giving frequent perineal care to residents? A. It increases comfort. B. It decreases sexual responses. C. It helps prevent skin breakdown. Or D. It prevents incontinence. The best reason is C. It helps prevent skin breakdown. When providing foot care to a resident, it is important for the nurse aide to A. Remove calluses and corns. B. Check the feet for skin breakdown. C. Keep the water cool to prevent burns. Or D. Apply lotion, including between the toes. It is important for the nurse aide to check the feet for skin breakdown. A resident who is incontinent of urine has an increased risk of developing A. Dementia, B. Urinary tract infections, C. Pressure sores, or D. Dehydration. The correct answer is C. Pressure sores. Urine can be very irritating on the skin, at risk of developing pressure sores. Okay, make sure you have a good knowledge of how to safely transfer and move the resident. Be ready for questions like these. Before helping a resident to stand who has been lying in bed, the nurse aide needs to A. Find out what the resident plans to do for the day. B. Make sure a walker is available for support in case it is needed. B. Ask if the resident has taken any medication recently. Or D. Allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is D. Allow time for the resident to adjust to sitting at the edge of the bed. The purpose of the gate or transfer belt is to A. Limit physical contact with ill residents who are transferred or walked. B. Protect the nurse aide's back when walking or transferring a resident. C. Help steady and support a resident when transferring or walking. Or D. Allow residents to transfer or walk independently. The correct answer is C. Help steady and support a resident when transferring or walking. When walking a resident, a gait or transfer belt is often A. Worn around the nurse aide's waist for back support. B. Used to keep the resident positioned properly in the wheelchair. C. Used to help stand the resident and then removed before walking. Or D. Put around the resident's waist to provide a way to hold on to the resident. Correct answer is D. Put around the resident's waist to provide a way to hold on to the resident. 46. When moving a resident up in bed who is able to move with assistance, the nurse aide should A. Position self with knees straight and bent at waist. B. Use a gate or transfer belt to assist with the repositioning. C. Pull the resident up, holding onto one side of the draw sheet at a time. D. Bend the resident's knees and ask the resident to push with his or her feet? And the correct answer is D. Bend the resident's knees and ask the resident to push with his or her feet. Standard precautions and infection control. Let's look at some examples of these questions. What should a nurse aide do with a disposable razor? A. Throw the razor in a trash can. B. Place the razor in a sharps container immediately. C. Clean, rinse, and dry the razor so it can be used again. Or D. Wrap the razor in a paper towel until it can be thrown away. Correct answer is B. Place the razor in a sharps container immediately. According to standard precautions, the nurse aide should wear gloves for which of the following procedures? A. Getting linen from a linen cart. B. Removing soiled linen from a bed. C. Performing range of motion exercises. Or D. Transferring a resident to a shower chair. And the correct answer is B. Removing soiled linen from a bed. Number 10. Gloves should be worn for which of the following procedures? A. Emptying a urinary drainage bag. B. Brushing a resident's hair. C. Ambulating a resident. Or D. Feeding a resident. In the skills lab with coronavirus, you wear gloves for all of these. But on the state exam, they are asking about standard precautions. So in which of these examples are you in contact with bodily fluids? So the correct answer is A. Emptying a urinary drainage bag. When using personal protective equipment, the nurse aide correctly follows standard precautions when wearing A. Double gloves when providing perineal care to a resident. B. A mask and gown while feeding a resident that coughs. C. Gloves to remove a resident's bedpan. And D. Gloves while ambulating a resident. And the correct answer is C. Gloves to remove a resident's bedpan. All right, 41. To help prevent resident falls, the nurse aide should A. Always raise side rails when any resident is in his or her bed. B. Leave residents' beds at the lowest level when care is complete. C. Encourage residents to wear larger sized, loose-fitting clothing. Or D. Remind residents who use call lights that they need to wait patiently for staff. Correct answer is B. Leave residents' beds at the lowest level when care is complete. To help prevent the spread of germs between patients, nurse aides should A. Wear gloves when touching residents. B. Hold supplies and linens away from their uniforms. C. Wash hands for at least 2 minutes after each resident contact. Or D. Warn residents that holding hands spreads germs. The correct answer is B. Hold supplies and linens away from their uniforms. Remember, this test was written before coronavirus. Before coronavirus, you did not wear gloves when touching residents. C is incorrect. It's not 2 minutes, it's 20 seconds. And D, we don't need to warn residents that holding hands spreads germs. When a sink has hand-controlled faucets, the nurse aide should use A, a paper towel to turn the water on, B, a paper towel to turn the water off, C, an elbow, if possible, to turn the faucet controls on and off, and D, bare hands to turn the faucet controls both on and off. The correct answer is B, a paper towel to turn the water off. Be ready for scenarios. How can you play along with residents who have dementia? A resident whose husband died a few years ago says, I have got to get dinner started. My husband will be home from work soon. What is the best way for the nurse aide to respond? A, offer to walk with the resident to the activities department kitchen. B, remind the resident that the nursing home prepares her meals. C, ask the resident about her husband's favorite dinners. Or D, explain gently that the resident's husband is dead. The correct answer is C. Ask the resident about her husband's favorite dinners. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A, put the hairbrush away and out of sight, B, give the resident the hairbrush to hold, C, try to dress the resident more quickly, or D, restrain the resident's hand. The correct answer is B, give the resident the hairbrush to hold. Here we go. A resident often carries a doll with her, treating it like a baby. One day she is wandering around crying that she can't find her baby. The nurse aide should A, ask the resident where she last had the doll, B, ask the activity department if they have any other dolls, C, offer comfort to the resident and help her look for the baby, or D, let the other staff know the resident is very confused and should be watched carefully. The correct answer is C. Offer comfort to the resident and help her look for the baby. A nurse aide finds a resident looking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to A, help the resident back to his room and into bed, B, ask the resident about his job and if he is hungry, C, tell him that residents are not allowed in the nurse's station, or D, remind him that he is retired from his job and in a nursing home. The correct answer is B. Ask the resident about his job and if he is hungry. Sundowning is a term used to describe when residents A, take short naps throughout the day, B, show signs of Alzheimer's at a young age, C, prefer to go to bed earlier in the evening, or D, become restless and agitated late in the day. Correct answer is D, become restless and agitated late in the day.